Hi, my name's Phil. I like talking about politics. In this video, I'd like to discuss the way in which the Health Secretary offended a lot of people by trying to shift the blame away from the incompetence of Cabinet, which is nothing new, but onto frontline NHS workers, which is a little new. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So, a little bit of background to all this. So, in the UK, we had more warning of the coronavirus pandemic than most other wealthy nations. We certainly had time to prepare resources for our already overstretched health service, and in fact you'd have thought there'd be an imperative to do just that. We saw the much stronger and better resourced health services in other countries being stretched by the pandemic, and knew that our NHS would be in a much worse position to cope with the same level of infections after 10 years of being undermined by the Conservative government. Now, there was nothing that could be immediately done, of course, about the 10 years of abuse, but we could and should have instantly stocked up on the equipment that we knew the NHS were going to need a lot more of. And it was surprising that they didn't, even to people highly sceptical of the Conservative Party, such as myself. It was genuinely surprising that they didn't at least do that. They turned down the chance to get in on tens of thousands of ventilators that we'd need. We were receiving news that the government were not even ordering equipment from manufacturers, even based in the UK, that could have provided it. We also weren't buying more of the personal protective equipment, the PPE, that the frontline NH staff desperately need. Frankly, before we're ever going to be able to return to any sort of normality, I saw newspaper headlines today saying that we're not going to return to normal for a year. There's not going to be any return to normal until there's going to be a stage where those of us going out, just when we've eased restrictions, are going to have to wear face masks. That's the way. We can see that from other countries. We know from countries that have the situation under control that the only way to avoid being in a lockdown is to make sure that people out and about do not spread the infection to others, because there'll be lots of people who could be infected and will have no idea. And that means we're going to need face masks at some point. You know, the face masks work best at preventing you spreading the infection to others. In terms of protecting yourself from infection from others, you need rather more coverage, which is why the full PPE is needed by NHS staff. We had the news last week, for example, that there were nurses who'd been buying bin bags and putting them on each other to use as makeshift PPE because the government were not giving them the equipment that they need, and some of those have now tested positive for the coronavirus. Who knew that a Blue Peter solution was not going to be what our NHS really needed? Other medics have described having to buy supplies themselves, and on Friday the government really did take the piss. So on the daily press conference, Matt Hancock, when he should have been apologising for the government's behaviour, quite frankly, and setting out what they were going to do to improve it, chose instead to lay the blame squarely at the feet of frontline NHS staff, risking their lives because of this useless article. We need to treat PPE, he said, like the precious resource it is. No, Mr. Hancock, you need to order more of it so it becomes much less precious. The usual Tory behaviour of saying that they're funding the NHS whilst actually underfunding it is galling at the best of times. It really upsets me. But right now it is particularly insulting. The government said that money was no object when it comes to giving the NHS what it needs to beat this crisis. But it was lies. The reason they don't have the PPE they need isn't because ministers can't decide which supplier to order from or what colour it should be in. It's because they don't want to pay for it. It's just the same old pinching pennies when it comes to public services. About the only thing of use that I can tell that Matt Hancock has actually done during this emergency is to charter a load of private hospitals and staff to meet the extra capacity needs. But that works for a Tory minister because it means giving public money to already wealthy individuals with minimum scrutiny in the private sector. Not that I'm saying he shouldn't have done it, absolutely he should have done it. That's why I said it's a useful thing to have done, but it just highlights how this Tory way of thinking is costing lives. They'll fund private hospitals because they like privatisation, but they won't fund enough equipment for NHS staff who are now dying for the lack of it. A precious resource, he called the PPE. NHS staff are the precious resource, and the government are taking no care over them at all. A so-called nursing leader was also at the press conference and was called upon to say also how many frontline NHS staff have died from this infection then. And she refused to answer. She said it wasn't appropriate to answer. I think it's very appropriate, and I think a lot of people thought it's very appropriate. Since then, I gather Matt Hancock has said that 19 have died. But two things sprang to mind there. One, why did they resist answering in the first place? Two, why has there been no apology for the 19 needless deaths of NHS frontline staff that Hancock is happy to clap like a seal for, but not sign a piece of paper that orders them the equipment they need? And three, why is he saying 19 when there are commentators who seem able to specifically name 27 individuals of frontline staff on the NHS who have died from this virus? Is he trying to exclude certain groups of frontline NHS staff from this figure, I wonder? And just to finish, coming back to that idea of clapping for the NHS that we have every Thursday now, when you're doing it next Thursday, if you are doing it, I'd just like you to reflect on a few things if you would. The exercise was pushed by a government that are failing to provide the real help that the NHS need, and a media that is failing to write articles about these failings. You may be clapping out of the very best intentions, very warmly felt, but you're playing along with their game. Now, I'm not going to say don't clap because of that. If you want to clap, if you feel better from clapping, then do so. If you feel that you have neighbours in the NHS and they'll appreciate it, by all means. But when you're finished, perhaps what you'd like to do afterwards is to find the time to email your MP. Doesn't matter which party they represent, email your MP and ask them what they are doing to ensure that the NHS get the equipment that they do need. And ask them also if they agree that it's wrong to blame frontline NHS staff who are losing colleagues on a daily basis now for the lack of protective equipment. So anyway, those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.